Hello, good morning. My name is Nos Balogun. Today we are talking about diabetes. Diabetes mellitus. Diabetes is a condition in Yoruba language. They call this ito sugar. It's a condition whereby there is increased blood sugar level into our body system, and it's a condition that affects all ages. Disease process yìí gbogbo èèyàn ló affect àtọmọ kékeré àtàgbàlagbà o, ọkùnrin obìnrin everybody ní diabetes affect. Then what are the main thing about diabetes mellitus? When there is high blood sugar in the body system, it means the insulin are not working well. What do I mean by insulin are not working well? Insulin is an hormone that is being produced by the beta cell in the pancreatic islet of the Langerhans of the pancreas, and this insulin helps in putting sugar into the cells, like is giving the cells the food to eat. So where the insulins are not working, or probably the beta cells are not producing enough insulin, or probably the beta cells are being worn out, they are not even producing insulin at all. That is when you have more than enough blood sugar in the body system, which we call diabetes. And mainly there are many types of diabetes mellitus. We have, and we're talking about these two main types. That is, in fact, is the one that is really common, which is type 2, but I'll be talking about type 1 and type 2. Type 1 diabetes mellitus, this is a kind of diabetes that is an autoimmune. It is caused by autoimmune, is hereditary. Most times this type 1. Type 2 diabetes, that is this type 1 diabetes mellitus, the insulin, there's no production of insulin at all. The beta cells are not producing insulin. This type 1 diabetes mellitus, so it means that they are insulin dependent for life by insulin, because the beta cells are not producing insulin at all. The type 2 diabetes mellitus, this type 2 diabetes mellitus, the insulin is being produced but in a minimal level. That is, the beta cells are producing it, but it's not up to what is expected. You understand me? It's wearing out, it's not producing what is expected, and this mainly is caused by dietary mostly the food we eat, especially this processed sugar, drinks and the rest, and our lifestyle. When we have limited physical activities, as people don't usually move around and they eat a lot, most of our foods are carbohydrates, and carbohydrate, when it's being breaking down, the end point is sugar. So more or less we are eating sugar. You understand? Carbohydrate, the breakdown is glucose. So when we don't make use of these carbohydrates we are eating, understand, and there is more than excess in the body and we are not making use of it, probably we have a sedentary lifestyle that we don't usually move around. When we move around, the energy is being used, glucose is being used, you understand. But when you don't move around, there's no energy, there's no physical activities, so the energy is, you are just sitting down, so your glucose is being accumulated and you are still continue eating, eating. There is more glucose in the body system, and if this thing persists like this, definitely diabetes might come up. Let me use the word will come up. It might come up if you don't work towards your physical activities. That is type 2, which is really affecting us in the country, Nigeria, right now. That type 2 diabetes mellitus is the most common diabetes mellitus we have in the country. Then sorry, let me talk about metabolic syndrome. This type 2, when there is increased blood sugar level, increased blood pressure, when you have high lipid, that is high cholesterol level, and you are obese, you collect as a metabolic syndrome. This is a condition whereby there are two or more disease condition. Then about two or more disease condition in this body system. They call it metabolic syndrome, which is a bit complicated than diabetes, because that person is having diabetes, is having high blood pressure, which is hypertension, having high lipid profile, that is high cholesterol level. The person might even be having obesity. Definitely this is metabolic. When person has 2 or 3 out of this, what I mentioned now, person is suffering from metabolic condition. So let me talk about signs and symptoms. What are the signs and symptoms we might see or we might notice? that we say, like a so okay, if I need pre-diabetes or diabetes, yeah, so we need to sugar by kí làwọn nǹkan tí we should be working towards. Signs àwọn nǹkan tí mo wo lára mi yìí kí ló ń ṣẹlẹ̀, we call it polyuria. Èèyàn máa tọ̀ ṣá, there will be increased frequency in urination. Polydipsia, wọ́n máa mu omi. Polyphagia, wọ́n máa jẹun. When they finish one food, they want to eat another, they want to eat another, they want to eat another. These are the 3 cardinal signs of hyperglycemia, which is diabetes. Polydipsia, excessive tasting. Polyphagia, excessive eating. Polyuria, excessive urination. These are these 3 main ones. And we have fatigue. They might have blurred vision. Losing weight. This losing weight is as a result of when there is excessive urination, and they will not have this much strength, and along will shrink, maybe urinating all the fluid until urinate, they will have this weight loss. These are the main signs and symptoms of diabetes mellitus. So then let me quickly talk about diagnostic investigations. How do they detect if you have diabetes? We call something fasting blood sugar. This fasting blood sugar is done in the hospital, in the laboratory in the hospital. When they take your blood level, they will tell you to stop eating starting from 9 p.m. or maximum 10 p.m. following night till around 7 or 6:37. Before 8 o'clock, your blood will be collected, and they will check your blood level for sugar. It's called fasting, because you fasting overnight. That's why it's called fasting blood sugar. This should not be more than 100 milligram per dl. It's not more than 100 milligram per dl. In fact, okpo jùlọ máa jẹ́ 110 or 120. When it's getting higher and higher, it means when it's above 120, that is pre-diabetes. When two or more subsequent tests like that, it's like you're having pre-diabetes. And if it's above 140, 150, diabetes is this is diabetes. You understand? And that one is random blood sugar. Some people, when they come to the hospital like that, they will say, I've eaten. Even if you have eaten, you understand, they will still check your sugar level. When you check your sugar level, it's supposed to be within the range of 120, 130, 140, maximum 150. It depends on what you eat. You understand what I'm saying? Above 150, 160, when you're having something, that person might have diabetes, might not really know. You understand? There's one we called hemoglobin H1C. That's hemoglobin. This one is a blood test that it shows that how blood sugar level lára for the past 3 months. Tó bá ṣe test, it will show the range of the sugar in our blood for the past 3 months. So this one too has a value less than 5 is good. Above 5 or 6 is telling us there's something wrong somewhere. So these are the tests, and it's mainly done in the hospital. So let me talk about complication of diabetes mellitus. Complication, it causes heart and blood vessels complication, like hypertension, heart diseases. It causes retinopathy. They will having high damage. You understand? Because there's interlocking between diabetes and hypertension, diabetes and heart condition, heart and blood heart condition. There's this interlocking between the two of them. So someone that is hypertensive should be watching for diabetes. In fact, someone that's diabetes should be really watching out for hypertension, because one of the major complications of diabetes is hypertension, is heart disease. Let me put it that way: heart disease, cardiovascular disease, retinopathy. There is not enough blood supply into the eye. It causes blood vision and eye damages and the rest. Nerve damages. We have kidney nephropathy. There's kidney damage, which is nephropathy. You understand? So all these are they are complications of diabetes. You know what I'm saying? So let me talk about prevention. What are the prevention? The main prevention that is in type 2 diabetes mellitus. The main prevention for type 2 diabetes, which is the most common. And why is it most common? It is the most common because of what we eat and our activities. You can see there is this processed food. People, because of this, let me say, this economic stuff, people really find it hard to really cook at home, so they just on the go gala. Sorry, don't let me say, they just get the snacks, understand, they get the snacks, a drink, they just take it to just, they just be on the go, to just be going. So accumulation of all this sugar sometimes, you understand, the complication will arise. Or probably some people, while they are eating, if they've not stepped down with something sweet, they will not feel that they are eating, you understand. All this lifestyle, they are not really too good at all. So our eating habits really affect type 2 diabetes. And also sedentary lifestyle, just sitting down in one position without having enough physical activities, all the food we are eating, we are not making use of it. You're not doing any exercise, you're not making use of it. It's just being accumulated, you understand. It's just being accumulated, and you are giving your pancreas, your beta cells work to do. So when the beta cells are often doing work to produce insulin, so that they can absorb insulin, and they can absorb the glucose and put it inside the cell. When the extra work they becomes worn out, and they will not be effective again. So it's like you are giving your beta cells, your pancreas, excessive work to do. So in that case, when they become worn out, machine wà tí wọ́n ṣe machine, you understand, machine gan máa rẹ machine, tí machine bá ti ṣiṣẹ́ tó bá yẹ ó máa rẹ̀, tó bá dẹ̀ ti rẹ̀ kẹ́, what will we do? We get another machine, you understand what I'm saying? So all these things contribute to diabetes mellitus. That's type 2 diabetes. So if you watch what we eat, you understand, we cut out some excess fat, you understand, and obesity, like this excess pounds or kilo, you cut it out, you reduce the food you eat to some extent, and you eat healthy meal, you reduce the processed food, processed sugar stuff, you engage in more physical activities, and you cut out some pounds, like kg excess fat from your body system, you understand, you are preventing diabetes mellitus. Thank you so much. Thank you for listening to me. Please don't forget to subscribe to our channel for more updates. Bye.